You guys are amazing. We said we need to do this for the community, and you said, let's go. Actually, you said, let's do this for the community. And then more of you came on and said, yes, let's do it. And all we did over here at Rabata is say, oh my God, you guys are great, and provide the space. So alhamdulillah, welcome to all of our guests here today. And I know that we want to get right down into business, so that's what we're going to do. I just want to introduce our guests. We have here on the panel right now, or I guess I will, just 1 minute as I pull up my info. بسم الله الرحمن الرحيم صلاة والسلام على خاتم الأنبياء سيدنا محمد وعلى آله وصحبه أجمعين. Those of you who are joining us here today, you may not know this platform. I am going to just say that our platform here does have a limited number of people. So we are nearing that limit now, and we are recording. So if anybody you know comes on and they couldn't get on, let them know that this will be recorded and they will be able to watch it later. I'm Tamara Gray, and I am the Executive Director and Chief Spirituality Officer for Rabata. That's Chief Spirituality Officer part is one of my favorite things. And we are here. Our work is to create positive cultural change, to create educational opportunities. So it's all about education. I believe in education, the power of education. Hopefully today, your education, this educational moment will be empowering for you, but also empowering and will give you the tools that you need to manage the next few days and to understand what's happening. We have on our panel here Dr. Nour Akhras. She's right next to me on the way. Your screen might look different than mine. Yeah, thank you for waving. Dr. Nour is a pediatric infectious disease physician, and she was trained at the University of Michigan. MashaAllah, she's the mother of 4. She's on the board of Med Global, which is an NGO dedicated to ending healthcare disparity across the globe. She's working hard to help us all around the world. And next to her is Dr. Zaynab Ahmed. She is also an infectious disease expert. She's not pediatric, she's adult infectious disease specialist. She's from, I don't know how to say the name of the town, Waukegan maybe, Illinois. Did I say that right? And she graduated with honors from the University of Illinois at Chicago Health Science Center in 2009. For the last 11 years, the majority of her experience and expertise has been in this infectious disease world. So we're really excited about how they're going to contribute to our work here. We also have Dr. Malik Bukhari, who's coming to us from Pittsburgh. She's a cardiologist. She's a practicing colorectal surgeon in Pittsburgh, Pennsylvania. She graduated from the Royal College of Surgeons in Ireland. Well, I didn't know that. She's been practicing for 22 years. She's also got a master's degree in public health. So she's been very concerned. In fact, it was Dr. Malik's idea. She was the first one to pop up and say, we have to do this. So that's her public health hat that she's got on, and she's concerned about all of us. Dr. Amina, who's next to her, Dr. Amina Hakim, is coming to us from the UK. And she's a general practitioner. She lives and practices in London. And if any of you are joining us here from the UK, she will also have questions specific to the NHS and how the NHS is dealing with this and what you need to do regarding medical care there if you need it. Right, we're also missing Dr. Sadia. She'll be on soon. She's an internal medicine endocrinologist doc, and she's also very interested in functional medicine, so she'll also be giving us some info about taking care of ourselves. And Dr. Nazneen Mohab may be able to come on or may not. She's on call today. Along with her cardiology degree, she has a master's degree in global health. So, Bismillah, I'm going to go ahead and drop off and let Dr. Nour and Dr. Zaynab start, and then we will have all of us come back on during the Q&A session. Just to let you all know how this is going to go, we're going to start with a presentation, and there is a Q&A box here. So if you've never been to this platform before, that Q&A box, nobody else can see what you're writing in there. Only you can see it. So it's not a chat box. So if you're saying salam and things like that, actually people can't see it. That's why you're not being responded to. So forgive us for that. We have removed the chat box just so it's not distracting for the doctors. We're going to be asking and answering questions from the Q&A box after the presentation. I will be helping to organize and manage that. If you have any tech concerns during this time, Admins, what should they do with tech concerns? Just go ahead and put it in the Q&A box, and I will have an admin reach out to you in that case. I think that's about it. Bismillah. Yep, I think that's good. And so thank you, and I will drop off and let our infectious disease specialist get started. So just turning off my...
Assalamu alaikum, can you guys hear me? Bismillah ar-Rahman ar-Rahim. Jazakallah khair, Anse, for the wonderful introduction, and we truly feel humbled and honored to be a part of this panel. I'm very happy to be here with Dr. Nour Akhras to discuss coronavirus disease 2019. Before I begin, I do want to put out a disclaimer that any information that we present are our sole opinions and not necessarily affiliated to an institution. And Bismillah. So before I begin, I just want everyone to take a deep breath with me. Take a deep breath. And the big message that I want to impart to you all is that we will get through this, okay? It is going to get worse before it gets better, but we do need to work together to prepare and make sure that we take the appropriate precautions and recommendations so that we can come out of this together, and we will get through it. So the information that we are about to present to you may appear a little scary, but don't panic. We'll work together. We have recommendations for you, what you should be doing, and we will get through this, okay? So next slide. Let me see if I can you see the next slide? Okay. So to begin with, for the objectives of the presentation, at least the first part of the presentation, before I hand it over to Dr. Akhras, we'll go over some definitions, what are the phases of a pandemic, some background on just coronavirus, the U.S. federal response up to this point, and the state and local public health response and what our recommendations are. So to begin with, definitions. An epidemic is a widespread occurrence of an infectious disease in a community at a particular time. So it might be pockets or areas within a community in a country where there might be an infectious disease at a certain time period. Now, in order to go up to a pandemic, this is a disease epidemic that spreads across large regions of the globe. It includes multiple continents and is worldwide. So as you know, the World Health Organization just fairly recently declared the coronavirus 2019 disease to be a pandemic. Okay. You also probably hear quite a lot in the media the term community transmission. This is when cases of infection occur without a known source of exposure. So for example, in the very beginning of this, you probably heard of cases or people who were infected that had traveled from a particular region where there was ongoing disease infection. Or you heard of cases that might have been direct contacts to another case. So community transmission is when this source of exposure is unknown, and the thought is that there is some underlying community spread that is occurring within that particular location. The next term that I'd like to define that you probably also have been hearing about is the word containment. And in the beginning of the spread of COVID-19 disease within the United States, we were really working on containing, which is to control the spread of infection, and I will be giving you an example of one strategy that was used to do this. And lastly is the word mitigation. This is a term that is also used by public health officials, and you've been hearing it in the media as well. And this means to slow the spread of infection. Okay, so the different strategies that we use to slow the spread, or flatten the curve of infection. So let me talk to you a little bit about coronavirus. It is a virus that comes from a large family of viruses. The novel 2019 novel coronavirus is a part of this large family of coronaviruses. Coronaviruses do circulate, certain strains of coronaviruses do circulate among animals, but they can also circulate within humans. Very rarely does a strain or a type of coronavirus that is in animals evolve or mutate and jump and infect humans. And we've seen examples like this throughout history. We've seen it with MERS, we've seen it with SARS. So this is another type, a novel, new type of coronavirus that has mutated, previously circulated in animals, and now has jumped to humans. The way that the new coronavirus, which is named SARS-CoV-2, spreads is that when an uninfected person is around an infected person who's coughing, sneezing, or talking. So when you cough, sneeze, or talk, you emit respiratory droplets that go into the air. The other person who's not infected inhales that, and then that takes up shop basically in the back of your throat and potentially in your lungs. And for this reason, if you do get exposed and infected, you can get what they call respiratory illness, which is composed of fever, cough, difficulty breathing. Now, people who have other medical conditions, who are elderly, we are finding that they go on to have severe illness, which is complication of pneumonia. And we're seeing it in both lungs. It's a really bad inflammatory reaction of the lungs that's causing people to have difficulty breathing, have difficulty, failing in breathing and being intubated and put on the machine. So next I will be talking about the phases of pandemic. So in front of you, you see a graph, and it's from the CDC. It's published in the MMWR in September 2014. And basically, on this graph, you see what the phases of a pandemic are. Now, the investigation, recognition, and initiation phases have already occurred. And in those phases, basically, what happens is that a strain or a type of virus is identified that could potentially impact public health. Recognition is when you start seeing a couple of cases. Initiation is when you confirm that it can spread person to person. And to be frank, right now we are at the start or right before we're jumping into that acceleration phase. So we have yet to see that peak. And that is why public health officials, why healthcare providers are very concerned, because we are going to see it soon, and so we need to be prepared. So going into a summary of what we've done so far in terms of the government as well as state and local. The federal health response has included developing guidance for public health, doctors, schools, and communities. As you know, number of travelers from countries where there's already documented spread in the community have been reduced. Travelers from China were on mandatory quarantine, and as you know, individuals who were coming off of cruise ships were also mandatory quarantine at select locations. They've instituted airport screenings for return travelers from China, and the CDC worked quickly to genetically sequence the virus and develop a diagnostic test that then was approved by the FDA through emergency use authorization and provided to state labs and labs across the country and the world. In terms of state and local public health response, it's been several aspects that we have been really trying to focus. And I know Dr. Ante had mentioned that I am from Waukegan, Illinois, and so I'm actually a medical epidemiologist at the health department. So our response at the local level has really targeted multiple avenues. We are monitoring the effectiveness of any guidance that we are providing or what the federal government is providing. We continue to investigate individual cases, and we monitor the number of cases that we're having in our jurisdiction. So in my county, for example, we're monitoring the cases, and as the case numbers increase, we may go from just identifying one case to looking more at overall identifying people who are having severe illness or who are coming in with flu-like symptoms. We monitor for changes in epidemiology, and basically this means we look at the behavior pattern of the virus, what it's doing and how it's acting, and based off of that and how it's impacting individuals. We also facilitate transmission of submission of samples to the state laboratory. We activate or expand appropriate strategies to try to slow down the virus spread within our communities. We monitor and respond to surge in healthcare needs. So for example, as healthcare systems get overburdened and there are people lining up and there are not enough resources, we try to work to help meet the needs of the healthcare systems. And then we try to collaborate and share updates with all partners involved. So those are just some of the pieces that we work on, and they're more overbroad. During the Q&A, I can go into more details about that. The last slide that I have for you, or the second to last slide, is an example of how the local health department has been investigating during this containment phase before we go to the mitigation part. So in counties or localities where there's been a few cases, what we're able to do is, for example, identify the case, which is in the red circle. And then what we do is we work to identify all the close contacts, so all the people that might have been exposed to that individual. And those are all the other white circles around. And it's a very small world now, so what we find is that, relative to the 15 or 20 contacts that a person might have, we actually see more than that. So people have more contacts because they get around more, they're more mobile. We also work to identify if that person, while they had symptoms, had gone to clinics or hospitals where possible exposure may have occurred. We also look at if they've gone on public transportation, attended any large gatherings, took any travel or flights, or had any visitors at home. So just one person's contact investigation can be very lengthy, involve a lot of follow-up on each person. And if we identify close contacts that might have been exposed to a person, we work to make sure and ensure that that person doesn't develop symptoms, monitor them very closely, have them stay home for 14 days before they can return back to work or school. And again, I can go into more details at a later time. The last slide are just some resources for you that as you prepare your own household for this pandemic, the CDC has really good guidance on how households and families can prepare. They have a checklist, they have guidance on what you should be doing, and also importantly, there is actually resources for community and faith-based leaders, what they should be doing for large community events and mass gatherings, and also, most importantly, about cleaning and disinfection recommendations. So I'm going to hand it over to Dr. Akhras to continue on the conversation.
Okay, Assalamu alaikum. Bismillahirrahmanirrahim. Thank you, Sana, for that introduction about what public health is doing. I'm more on the hospital side and what we're seeing in the hospital and what we're doing in the hospital. As Sana mentioned, the novel coronavirus is a new virus that has started to spread initially from China, and now it's a pandemic, as the World Health Organization deemed it a couple of days ago. And in the world of virology, we look at transmission, and we also look at mortality rate, and we compare those to other viruses. So in terms of transmission, there's a coefficient called R0, which just tells us how infectious the virus is. And so coronavirus 2, or SARS-CoV-2, which is the virus causing COVID-19, which is the disease. So SARS-CoV-2, the transmissibility is now being estimated between 2 and 4. So that's the R0 coefficient. And so what that number means is that for every one person who's infected, they may infect 2 to 4 other people. So to compare that, for example, to the seasonal flu, the R0 of seasonal flu is 1.3. So for every person who gets the seasonal flu, they'll infect 1.3 other people. And there's more contagious diseases than this SARS coronavirus 2, which is like measles. That coefficient is 12. So that's really infectious. So when we're talking about infectability, one of the reasons that this virus particularly is a little bit scary, even though I agree with Sana that we all need to take a deep breath and be calm. But the reason that we have a heightened alert system about this virus is because the incubation period is long. So the incubation period of the virus is when you get infected from somebody else and the virus is replicating in your body, but you don't have any symptoms. So you're not having the fever, you're not having cough, so you in fact don't know that you have the virus in your body. So you're walking around doing your business, you go to school, you're working, or whatever you do, and as you're talking, you are emitting these respiratory droplets that have the virus in them, and the person next to you is inhaling, and you're infecting 2 to 4 other people. Also, like if you sneeze and your droplet gets onto a surface, the virus can live there for a few hours or a few days. We're not really sure at this point. And so somebody comes and touches that same surface and then touches their face, and that's how the virus gets transmitted to the other person. So because of this kind of prolonged incubation period, so this virus we know has an incubation period from 1 to 14 days, but the average is about 5 days. So there's about 5 days you're walking around with the virus replicating in your body. You don't know because you don't have symptoms, and you're going about your daily business, talking to all of these people, and potentially infecting them. So the next aspect of the virus that we think about a lot is the mortality rate. So the mortality rate, as I'm sure you've all heard, goes up exponentially when you're a lot older, so the elderly. So when you're 80 years old and older, the mortality rate for those people is about 15%. And for 40 and younger, it's under 1%. And so in those age brackets between 40 and 50, 50 and 60, 60 and 70, it continues to go a little bit higher, but really it takes off 80 and above. And then for people with underlying diseases like asthma, cardiovascular disease, smokers, and emphysema, COPD, those people don't survive the virus as well as healthy young adults and children. So the mortality, actually average mortality is 2 to 3%, so it's not really that high. And so when you talk about mortality and that number, 2 to 3%, you start to think like, okay, what's the big deal? Like that's not that aggressive in terms of other infectious diseases or other viruses. And so you hear a lot in the public of, oh, this is just like the flu, or this is not really a big deal, or things like that. But the reason this is a big deal is because of that longer incubation period where we don't know that we're transmitting the disease. And so public health experts and epidemiologists and infectious disease people have been kind of really waving the flag in areas where the outbreak is starting to show, to say that we really need to flatten the curve, as Dr. Senna mentioned. Like we need to flatten the curve to have the, there's no doubt that this virus is going to probably infect maybe 70% of the population, and one of those reasons is because it's a brand new virus and we don't have nobody has immunity to it. So none of the adults or children have immunity to this virus because our bodies haven't seen it before. So probably 70% of our country, and now I'm talking just the United States, and the other people from other countries can chime in on their status, but in the United States, we anticipate that about 70% of people will probably get infected with this virus. And once we get to that level, then there's something called herd immunity, where a lot of people will have antibodies and maybe will be attenuated. But okay, so this is the take home, like why we need to care. We need to care because if this virus spreads fast in the community, and 20% of people, we know this from China and Italian data, that 20% of people who get infected with the virus will need hospitalization. So they'll need to be hospitalized. So if 20% of the 20% of the American population needs to be hospitalized all at once, our healthcare infrastructure will fall apart because we don't have those number of beds, we don't have those number of ICU beds, we don't have those number of vents, we don't have those number of systems to deliver oxygen to people who need it. And so this is why it's really important to listen to your public health officials. So whatever they're telling you, you really need to take it seriously. So if they're saying we need to close the school in your area, they need to close the school. If they're saying we're closing the gyms, we're closing the gyms. If they're saying social distancing, social distancing. And it's really just to prevent the virus from spreading fast, because we won't be able, as a healthcare infrastructure, we will not be able to sustain supporting all of these people. And besides all of these people that have the coronavirus infection that need hospitalization, there's always other people that obviously need hospitalization. So people who have their diabetes, or somebody comes in with appendicitis. And so imagine your appendix is about to burst because you have appendicitis, but the whole healthcare system is taking care of coronavirus patients. They're not going to be able to tend to your appendicitis. So I feel like a lot of young people are like, oh, it's not my problem, and it's just going to affect old people, and so why should I care? I'm still going to travel. I'm still going to shop and do everything that the local health department is telling me not to do because it's not my problem. But it is going to be your problem, because if you have, God forbid, an emergency and the healthcare system is overwhelmed with COVID-19 patients, it's going to be your problem. So it's really, really important that we listen to these measures of social distancing, of stopping Salat al-Jum'ah if that needs to happen, of not going to school if that needs to happen, of working at home if your local health department is telling you that's what needs to happen. So that's why I feel like I've been nonstop really pushing this message that we need to listen to our healthcare department recommendations. I feel like as Americans sometimes we don't listen, and we value our freedom, which most people value their freedom. But if we don't take this seriously, and we need to all be in, we all need to be in. So if I do it and my community does it, but then like the neighbor down the street is like, no, I'm not going to do it, or the community down the street says, no, I'm not going to do it, then it's not going to work. Like, we all need to do it. And this is really hard to like trust that everybody else is going to do what we're doing, but all we can do is control what we do, and we need to just really hunker down and listen to the public health experts who are telling us what needs to be happening in our local area. So I think I'm going to hand it back to Sana now, and she's going to tell you what the local health departments are telling us to do.
So very good. Thank you so much, Dr. Nour. So in terms of public health recommendations, it really is geographic specific. Now, I believe all the guests here today are from across the entire country and possibly even international. So as Dr. Nour had mentioned, it's very important to be connected to your local public health department, because what is happening in specific areas across the country may be different for one community or the next. So for example, what we see in Washington or even in certain parts of California, we see significant spread of COVID-19 disease. And for that reason, you may be hearing from family members or friends in those areas that significant recommendations have been made where large-scale social gatherings have been canceled, where any kind of community groups have been canceled, where there might be even school closures that are occurring. And so it's really to flatten that pandemic curve that I'm showing you, to have as many fewer cases as we can as possible when we reach that acceleration peak point. For example, in my own community here, we have a handful of cases, but we have no evidence at this point of community transmission. So the recommendations that our local public health might provide may be a little bit different from what other locations are providing. For example, urban cities like Chicago, like New York, are seeing a significant amount of cases. So they are doing social distancing. They might be closing their schools. They might be canceling gatherings of greater than 250 individuals. They might be telling you to stock up on your non-perishable items and make sure your medication is refilled for at least 3 months, to cancel medical appointments that are not urgent, that can wait. For example, your diabetes checkup, maybe instead of getting it every 3 months, pushing it out for 6 months if you're controlled well. All of these things to spare the healthcare system as well. And ultimately, if you're sick, stay home. Now, as we start seeing more and more community transmission, that recommendation changes. So you really have to pay attention to your public health department, be connected, because there's interventions that will be put in place, or mitigation strategies, as this progresses, as we see more cases. So you've got to keep an ear to the ground and know what's happening in your own community. In the future, there might be quarantines that occur. To be, frank, the United States has already taken significant measures to try to reduce. So whatever the next measures are, they will be potentially extreme. So we have to be prepared for that, because they are trying to aggressively flatten that curve and not have an outcome like we had in other countries. So with that said, I 100% agree with Dr. Nour in that we need everyone's cooperation. Everyone needs to work together as a community to ensure that the well-being and health of our community continues. And that's the way we should be thinking about it, not be panicked or stressed, but think of the large community and that we have to help each other out by protecting each other, by protecting our family members. By just doing that, if the entire community does that, and they do it, at each household, then the entire community will be protected. So that's the main message I think we both want to really get across.
So, we're gonna end this part of the session soon. So just what to expect and a couple other things. This is just the beginning in the United States, so people from UK and Canada can speak to what's going on for them. But in the United States, we are seeing just the beginning of the outbreak here, and I think one of the things I want people to take home is that this might be really long. So maybe a couple, like thinking like this is long term. This is not just maybe a week. The kids might be out of school. This might be like another 2 months because, as Dr. Senna said, this is just the beginning, and so we are just taking these. We're just seeing the few cases coming in. But again, if we don't listen to the public health departments in our communities where there is community transmission, the numbers are expected to double every 2 to 5 days. So if today we have 20 cases and we don't listen, in 2 to 5 days we're going to have 40 cases. In 2 to 5 days after that, we're going to have 80 cases, and on and on. And 20% of all of those numbers are going to the hospital and need hospitalization. So it's really, really important to listen to our public health department. And the other thing I wanted to mention is that this is a really scary time for old people or older people, our parents or grandparents. And so the messages that are being sent to them is that they should not leave their house, because if they do, God forbid, get infected, they have a high mortality rate or high likelihood that they need to be hospitalized, and it may take them 2 to 6 weeks to recover if they recover. So I think we really need to look out for the older people in our generation, in our neighbors, Muslim or not. Check up on those people. Ask them if they need help, if they need groceries, if they need you to go get something for them from outside. And this is a time for us to shine as human beings, as Muslims, and even our own, grandparents, and just really being sensitive to, like, if you're not social distancing, please at least social distance from your parents. And I know that sounds really hard, but FaceTime them, talk to them, but don't go visit them if you're not, if you're out and about. And so, like, even for me, I'm out and about in the hospital, and I'm not going to be able to see my parents for a while. I'm trying not to see my in-laws. I'm trying to keep my kids away from my in-laws, just because I know if I, God forbid, bring it home, I'm, might transmit it to my kids, and then they're going to transmit it to their grandparents, and that would be devastating. So just know who you're interacting with. Take care of the elderly in your community, the immunocompromised. That's another big chunk of people who are probably really scared at this time, immunocompromised people. So if you know anybody in your family who has immune system problems, your family, friends, neighbors, check up on them. Ask them if they need groceries. Ask them if they need you to do them an errand outside of the house, just to try to protect them as well. And so I think I didn't mean to scare everybody, but I feel like I'm getting a lot of pushback from my local community. I've been saying this for a couple of months now, and people are now starting to listen because they're seeing some things. But it's really important to listen to experts in their field, because, like, you wouldn't take your car to a chemical engineer, right? You would take them to a mechanical engineer. So, even some physicians are not giving recommendations as strongly as infectious disease physicians are. And so it's really important to just listen to the public health department and the epidemiologists in your area to help flatten the curve.
So much for that. It is a little bit scary, but it's also, I think that knowing what's real is one of the really important things. I was telling Dr. Nour the other day, I read a really important article in the newspaper that was comparing the Spanish flu of 1918 to today, and they said that the reason that the flu spread so fast in 1918 is because it was World War I, and so there was censoring going on. People, they weren't allowing the message to get out, and the article in the paper was saying that our issue today is the problem of fake news. Because of fake news, people are also not knowing what to believe and not knowing what to do. So for me, listening to the two of you, I feel like, okay, I can believe this and I can know what I'm supposed to do. I have questions, lots of questions in the box. I'm going to answer them, but I do want to ask the question. I'm going to ask them, I mean, not answer. I'm going to ask them. I will be asking them to you, and then we'll go about it like that, and I'll ask the other doctors to come on as well. I have a question, though. In regards to that issue of fake news, and both of you were really pushing us to listen to our public health officials. And I'm afraid that for many people, this idea that it's not, what's happening is not true. So when we had the in the United States, when we had the president's address yesterday, there was a lot of untruth there, or at least a lot of stuff that doesn't jive with what you were telling us today, a lot of untruth. And I know that I've heard similar feelings in the UK about things that have been said by the leaders there. And I'm sure maybe perhaps also in the world. And so who do we listen to? When you say public health officials, can you tell us what that means? Like, who do we listen to exactly? Who are we listening to?
So no, go ahead, take it.
Being a public health official myself, so basically what you should do is, and primarily for the United States, we are all divided into counties. So I represent Lake County. So what you really should do is really get connected to your county health department. They are your local health department. That then escalates up to the state health department, and then that escalates up to the CDC. So it's a network. The guidance that's provided by the CDC and the information that's disseminated from there goes to the state, that's processed, then it comes down to the local level and it's implemented. So we all work together in concert. So what's really important is that the local health department, your county, will have a good pulse on what's happening in your community. And based off of what's happening in your community, your medical epidemiologist, the communicable disease staff or prevention staff will be issuing guidance and recommendations. If you haven't already connected to your local health department, your county health department, or your village health department, or your city health department, sometimes there's municipal health departments as well. If you haven't connected to them, please, I encourage you and urge you to go to their website. I know that most of the health departments have a coronavirus website, or they refer to certain materials on there. We have our own, so that businesses and schools and faith-based communities and households can see what guidance is out there and what they can do to prepare. And the reason why I say that is because it's really community and local-led driven response, and you really want to listen to those individuals. And they've got phone numbers. I'm sure they're inundated right now, but feel free to reach out to them if you've got questions. They will answer those questions for you, and they will guide you where you need to go.
Okay. All right. Thank you very much. So just as a summary, for those of us who are lay people and all these words about local and county, all this stuff sound confusing. Think, what's your county? What's my county if you're in the United States? What county are you in? You know what county you're in because when you're watching the weather, you're looking for tornado watches, tornado warnings, and this kind of stuff in your county. Then you go online and you ask Google, Ramsey County coronavirus health department. And then you should get the website that you want, and it should be easy to just sort of look at that and find that. And what I hear you saying is that we should be confident in what we're seeing on those pages, that those pages are giving us accurate information. Dr. Ahmed, would you like to speak to the UK? Where would people go for information in the UK? Let me see. I gotcha. Okay, go ahead.
Thank you. They would go to the NHS England website, and there's also one for Wales and one for Scotland. And over there, there's actually very detailed, some of it for actual practitioners and some of it for the public. And they speak about exactly what they like them to do, any updates, what the statistics are, etc., and what they do if they need to isolate. So it's very detailed information.
Okay, so I'm going to just assume that that would be for any of the country in the world, that there's going to be information available for you, and if you kind of Google your area, and you should be able to find that. Okay, anyone else have any comments? And I'll go into the question box. We're all good. Okay, so at the top of this list here, I have a question that says, do masks actually help? What about that old face mask?
Okay, so we are recommending that actually people don't go out and buy face masks because there is a shortage of face masks, and once we run out of face masks, your healthcare provider, which is the people in the hospital, are not going to be able to take care of patients. And so the face mask also is sort of giving you a false sense of security, because a lot of people are like adjusting their face mask, and they're like taking it off and rubbing their nose, and things like that. And so when you're doing that, you're giving yourself these are the portals of entry. Our face is our biggest portal of entry. So better than getting a face mask is sanitizing, washing your hands, and really being aware of when you touch your face. Okay, so there's studies that show that if you're sitting at your desk, you will touch your face about 20 times an hour. So you're like rubbing your eye and rubbing your nose and your mouth, and this is how we get infected with viruses. So walking around with a face mask may or may not help you, but you're actually hurting the healthcare infrastructure by buying up all the face masks, and we're not going to have any supplies left because we're going to really need them. So please don't buy face masks. They may or may not help you, and they may provide you a false sense of security. Wash your hands a lot, and more than 20 seconds, or use a 70% ethanol sanitizer, and don't touch your face. That's going to help you more than a face mask.
That don't touch your face one, I never know how much I touch my face until the last couple of weeks. Looks like I'm a big face toucher. But we have a couple of questions in here that are, I feel like it's going to be, both of them, or the different questions are related to travel. So what advice would you give to people who want to travel, and would you recommend canceling all non-urgent travel? And I'm going to add to those questions domestic or international. So who would like to respond to that one?
So there has been travel notice level 3s that have been issued for certain countries in the world. So basically that means, and there's a CDC website for travel notices, so definitely if you are concerned about traveling to a location, please go on that website and look up that country. It will give you a level notice. So anything above 3 basically means non-essential travel should not occur in those countries. And currently that includes Spain, Italy, China, it includes South Korea, and now Europe, if you can believe it. It's travel 3 and above. So any non-essential travel to those countries should not occur at this time. It's definitely something that you should take into account when you are planning your travels for the next couple of months. Look at that website. In terms of domestic travel, we do know of areas and locations within the country where we have significant community spread. And also in particular, attending large conventions and gatherings, we have found that there have been outbreaks in those in those kind of settings. So try to avoid those. Try not to go to large conventions or gatherings in a different state because it brings people from all over there, and there's a likelihood that maybe someone with COVID-19 might be there. Additionally, I would say at this time there's no formal recommendations by the government about banning domestic travel, although today they did issue recommendations, the Department of Defense, that all military personnel will not be allowed to do domestic travel in the country. So just as a forewarning, if that's for military personnel, it's possible that in the near future, if we start seeing a lot of cases, we might be getting issued recommendations of no domestic travel. But as of right now, there's nothing formally recommended. However, I would say to reconsider travel to areas where we know that there's a lot of cases occurring, particular counties or communities within the country. So, for example, we know in Seattle, Washington, there's quite a lot of cases. So I would rethink that potentially if you go out there.
Dr. Malik, what could you add to that?
So I would add that if you do have to travel, I think then boosting your immune system is really something that we should all consider either way. So it is exercising that everybody knows. Exercise does boost the immune system. But what can you take when you are traveling? Well, if you wouldn't mind taking garlic, and you can do actually pills of garlic. Now, yeah, I see that smile, Dr. Gray, but garlic is a good immune booster. Now, okay, yeah, and that will keep people away from you too. So social distancing will really kick in. But garlic tablets, and it does say that they will produce a smell anyway, even though you're taking tablets. I think somebody recommended 2 tablets before you travel on the plane and then afterwards. Immune supplements, NAC is also a good immune supplement. So if you do have to travel, I think you have to take the precautions of eating healthy, exercising, social distancing in the airport, and boosting your immune system with natural supplements and vitamin C as well. And then the airplanes are also issuing what they are doing on the plane itself, cleaning the handles and utensils. So keep track on that as well. So that would be my recommendation if you do have to travel. I do have a question for Dr. Sana. You said large gathering. How large is large? I mean, some gatherings are like 10, 20 people, and some gatherings are like 50,000. So how large is large?
You should definitely refer to your health department because based on the county or the state, they may say cancellation of gatherings greater than 250 people. Smaller counties might have smaller numbers just because their population is small. I know a couple of counties in the state of Illinois that are very, very small counties, and they say cancellation of gatherings with 20 people. So it really varies and depends on where you're planning to go. So you have to look at that health department's recommendations as well.
So you actually answered a question that somebody else had been asking about what if elderly parents need to return home. Are there anything additional that we might say to elderly parents that are returning home? I know my parents are returning home next week because they want to be near a doctor just in case. So outside of the advice that you've already given, does anybody have any other special advice for elderly parents who are sort of coming home either from overseas or from domestic places, coming home in order to be the sort of just in case I need to be cared for kind of thing? Any other advice for them? Anybody? That's it? Okay, so just follow what Dr. Malik already said and get home quick, I guess, right? I don't know. Okay, we're going to go the other direction now. I think this is going to be for you, Dr. Nour, because this is about children. What would you recommend for a mom whose daughter has special needs and is vent dependent? Should we limit interactions with others? So I feel like there's a lot of layers to that question.
Yeah, I think for sure limiting interactions is probably going to be the way to go because, just even tying into that question of how large a gathering is large, you just need to know that the more people you interact with, the bigger your risk is, and you're just adding layers of risk. So the more you limit your interactions, the more protected you are, and by extension, the more protected your daughter is. And so just really, again, practicing safe hand washing and sanitizing before you come into your daughter's room, and limiting who you interact with and who else in your family, like whether it's the dad or other siblings, who they interact with, because that's just going to keep providing you with layers of protection. The less you see people, the less you're interacting with people, the more protected your daughter will be. So inshallah, that's helpful for that question.
And I'll just piggyback onto that. We have talked about this a little bit already, but there is a question here, and I thought maybe we could have just a really quick and simple response to the definition of social distancing. Could we define that just real simply? What does social distancing mean?
I guess I'll take that. So social distancing basically means that you really want to stay away from people and maintain a 6 feet, at least 6 feet distance from other people. Also, it could mean that if you are, let's say, being quarantined at home, and you might be at risk to your own family, then having your own bathroom, having your own bedroom, not really interacting with other people. But for the average public person, social distancing is just maintaining that 6 feet away from anyone, really not going to hug and kiss anyone. You know, we as women, we tend to be very boisterous in our affection and try to hug and kiss each other and say salam and, you know, shake hands, and really trying to avoid that and maintaining that distance, at least 6 feet, they say.
Yeah, so I want to say to everyone here just something from a different, rather than from a medical side, just from sort of an interaction with people side. It can be embarrassing to tell people, I'm not going to hug you, I'm not going to kiss you. And that's sort of a nafs issue, so we need to sort of go inside of ourselves and decide to take care of others by not kissing them. We always want to take care of their feelings by kissing them and hugging them. Let's take care of them now by not kissing them, not shaking hands, not hugging them, just not doing those things, period. And if we set the example, others will be able to follow without feeling shy about that. And I think really have to really listen and be strong and do that. And I know especially it's difficult for some people who just like as you said, it's just part of the daily interactions with people. You really have to be responsible to not do that. Okay, new question. How helpful is it to get a pneumonia vaccine?
So the pneumonia vaccine will not prevent you from getting coronavirus, COVID-19, but it is still recommended for 65 and older. And there's a different pneumococcal vaccine for little kids, but for adults, so you could potentially protect yourself from getting a superimposed pneumonia, which a lot of people get from any virus, from influenza or other viruses. So it's important to get that vaccine, but it's not going to protect you from COVID-19.
So would you also recommend that not only for 60 plus, but also for compromised people that have like asthma or things like this that are in their 30s or 40s or 50s?
So I'm not going to speak to an adult infectious disease.
For 19 through 64 years old who are immunocompromised, their vaccine is recommended. So you can definitely make sure those individuals who have certain chronic conditions and certain immunocompromised conditions can go ahead and get the vaccine. Like Dr. Nour.
So sorry, can you just circle back and tell us what does that mean to be immunocompromised?
Immunocompromised, sorry for using the term. Immunocompromised means weakened immune system, and that includes people that might have chronic diabetes who are not well controlled on it. It might mean individuals that have malignancy or cancer. It might be individuals that have rheumatoid arthritis and are on medications that weaken your immune system. So it could be a number of different conditions. And so that's really something important to ask your doctor, hey, do I have a weakened immune system, or do I have something that I take that causes a weakened immune system? And if they say, yeah, you actually do, then it's really important to be up to date on your vaccines. We're in the middle of flu season, and we continue to see increased cases of flu. If you haven't gotten your flu vaccine, you should really try to get that.
Oh, okay. All right. So, but I also kind of hear you saying not, so, because I've heard other things like, oh, if you just have a little bit of asthma, or if you just have this. For those people, they thought that's okay. They don't have to rush off to get a pneumonia vaccination.
For individuals that are 50 and older who have medical conditions like asthma or heart disease, that vaccine, there is a recommendation for vaccine, so those individuals might qualify.
Go ahead, Ahmed. It looks like you have.
Oh, just not under the NHS.
Comment.
Sorry.
NHS, yes, go ahead.
Not under the NHS. We do for flu vaccine. But for the pneumococcal one, it's more with the elderly. We give it to the elderly patients. However, it is available privately and can be actually done at most pharmacies. So if you come to your local pharmacy and discuss that with them, they'd be able to tell you the pricing, etc. So it's available. I'm not sure right now with the whether it is available just in the United Kingdom, but you can always ask your local pharmacy about this.
All right, so we're going to switch gears a little bit. Welcome, Dr. Sadia. We're so glad you could join us. We're going to switch gears and talk a little bit, review, I think, a little bit about what you mentioned regarding timing. So we have a couple of questions that are confused a little bit about that. So I'm going to try to put them together in this question. Can we have a clear answer on the contagion period? Early on, we've heard that it was 14 days. And then there was
5 o'clock.
Sorry, I have the computer.
No problem. And then somebody told us that it was 24 hours. They're not talking about you guys as a panel. They're talking about their own. Then we've heard that it was 24 days, but now we come back to 14 days. Was that middle information, 24 days, just a fluke? And then there are other questions also that ask, so when does a person start being contagious? Does a person start being contagious just when they first meet someone or it sort of lays on their body? Or do they have to start having symptoms to be contagious? Or, yeah, so those two together. Can we review that? I know you did talk about it, but can we just review that?
Yes, so again, because it's a novel coronavirus, we don't have all of the information, and actually some of the information we're studying today maybe irrelevant tomorrow. So you really have to keep up with what's going on. But the average incubation period is thought to be 1 to 14 days. So that's why we keep hearing this 14 days, quarantine for 14 days, 14 days. But there are people who will shed for longer, and so they're contagious for longer. And we know from other viruses that people who have an immune compromised or are immunosuppressed, they shed for longer, even with other viruses. So maybe that's where people are hearing 24.
Sorry, what do you mean shed? What do you mean shed?
Means that they're contagious, that when we speak, the virus is coming out. When we cough, it's in there. When we sneeze, it's in our particles. So again, there's a lot of research going on about the virus. So the average we think is 1 to 14 days, but of course there's going to be outliers, and we may not know the exact incubation period or how long people shed for another year based on all the studies, but really we think it's 1 to 14 days. And answering the question about when do you actually become contagious, so once the virus starts replicating in your body, so you inhale it when you're talking to someone who has the disease and maybe they don't know, but they cough on you or whatever, or you touch a surface and you put it into your eye and the virus starts replicating in your body. And so the average number of days from time of starting to replicate to symptoms is 5 days. So during that 5-day time period, you are contagious, but you don't know you have the disease. And that's the biggest issue, and that's why this makes it kind of scary, because you're replicating, but you look fine, you feel fine, and you're spreading it, and you're exposing people, but you don't know you're sick. So you are contagious, but you might not have symptoms at that time.
So do we then, and this is coming from the box as well, but it also really is a follow-up question to what you're saying, do we then need to have the mindset that we are all possible carriers? Is that how we'll get through this?
Yes.
And I'd just like to add that, although we're still learning a lot about the novel coronavirus right now, but from an epidemiological investigation standpoint, so let's say we find a case within our community, the way that we are actually looking at it is that if the person is having symptoms, they're the most infectious during that time, with the most likelihood of passing it on to another person, so that they can get infected. So it is possible, as Dr. Nour was saying, that if you, during those 5 days before you actually show symptoms, that you might still be able to pass it on. But the predominant time when you actually transmit it is when you're actually having symptoms.
Okay. So here's some questions moving to the summer, and when do we think that we're going to be able to get rid of this with summer sunlight? There are a couple of questions here asking, will summer sunlight and high temperatures stop the spread? And if so, what is the temperature that might kill this virus?
Anna?
Sure.
But that was a thought that came very early on in terms of the spread of this virus. To be frank with you, it's a novel, new virus. We are still learning. We don't know. We don't know how it's going to behave and interact with higher temperatures. And we'll just have to see. We'll have to see if it does slow down like flu season does, or if it keeps going. And we won't know until we get through that season.
Okay. Do you anticipate an eventual lockdown for the U.S. and or the U.K. the way Italy, France, and Spain are on lockdown?
I do.
Okay. What is that going to look like for us here in the United States, do you think? What does that look like, lockdown?
I think it depends on how, if the community doesn't prepare and does not do the recommendations of the health department, we are going to see widespread of this disease, and it might mean similar actions that are potentially taken in other countries. And some of those decisions may not be necessarily all public health. They might be more political too. So, I don't know, but they would be stricter, more stringent recommendations that would limit the movement of people potentially. And so I think the biggest message that we can all get across at this time is that please follow the recommendations of your health department. Do social distancing. Do the 3 C's. Cover your cough. Contain by staying home if you're sick, and then wash your hands. Make sure that you wash your hands and that you use alcohol-based hand rubs if necessary.
So based on what you're saying, the question of is this going to get under control in April or May or later? Can we even answer that question?
No.
No. Yeah. Okay. Wow. Okay. So let me go to a few others. We have some here that are maybe quicker ones. Working in an office with lots of other staff or eating out, should we be using paper cups and silverware? Can it be transmitted through in other words, paper cups and plasticware? Can it be transmitted through a contaminated sink or sponge?
It does live on surfaces. The virus can live on surfaces for a couple of hours to a couple of days. We don't know how long, but at least 2 to 3 hours. So yes, it can. If you put your cup down, for example, and swipe it back up where the virus was, it's now on your hand. So the answer is yes, and that's why some of the recommendations are if you're non-essential to physically being in an office, work from home.
Okay. Lots of other questions here about what about should we be going to the gym now? Should we be like how much of no? That's a quick no. So the person who asked about the gym, exercise at home, and all of you actually everyone who asked about the gym, exercise at home there. And there are also a number of questions around if I'm sick with something else, or if I had pneumonia in the past, and what is my risk level higher?
If you were sick in the past, no, I mean this again because it's a novel coronavirus, so none of us have immunity to it. So being sick in the past isn't going to change. But if you have a long-standing condition like asthma or emphysema or cardiovascular disease, diabetes, that makes you at greater risk to have a worse outcome if you catch the virus, but it doesn't mean you're going to catch it faster, for example.
Gotcha. That makes sense. Okay. And then also another question about children. What is the risk for someone with asthma who is young? We've heard about that risk when you're older. What about when you're young?
So a lot of the data coming out of China and other places is showing that children actually don't get a bad outcome with the coronavirus. So it hasn't really been stratified about children with like underlying disease. The numbers that are coming out are just saying like 0 to 9 years old or 0 to 15 years old are not having bad outcomes. So they're just getting kind of like a mild cough, fever, and a kind of just like a cold-like symptoms. But I haven't seen any data stratifying children with underlying medical problems. It's just saying like this is the data from children, period. So I think, and and I'm on a listserv of pediatric infectious diseases physicians across the country, and like last week they sent out a questionnaire: Are you testing for coronavirus? Are you seeing it in children? And across the board, everyone who tested was saying no. So that's thankfully, alhamdulillah. Hopefully the kids are protected.
I'm gonna guess.
I have a question. I want to ask a question about people who like cannot isolate themselves. So, for example, I have to go to work. I'm seeing 40 patients a day, and then I have elderly parents at home that I come home to, and it literally crossed my mind: should I move out? Because otherwise, who's going to bring it to them? It would be me.
I would move out.
Yeah. Wow.
Out, what you can do is just make sure that you're practicing very good hand hygiene, and that you're protecting yourself. So as a doctor, you're making sure that you're using the appropriate PPE when you see patients. If they have a cough, you're masking, they're masking, making sure that you're protecting yourself because you're at higher risk. Now, if you can't move out in those situations, what I would recommend is trying to do a little bit of social distancing. You don't have to be very stringent about it, but make sure you wash your hands, hand hygiene, change your clothes. Really try to avoid going to go and hug your mother or kiss your mother or your father, and but you can still potentially live in the same household. The reason why I say this is because when we get individuals that are confirmed cases, we do quarantine the entire family, but what we ask them to do is that practice social distancing within the house. So the individual who's a confirmed case, they would stay in their own bedroom and bathroom, away from the rest of the family, and then the rest of the family would be able to function, without being near that individual. So if you're sick, definitely stay away from them. I mean, I would say I would just avoid any contact with them whatsoever.
Okay, so building on that one, then also, what should one who is immunocompromised do when they suspect they have corona due to symptoms?
Okay, so it's really important to call your physician first. Don't just show up there, because this is how it spreads. And so one of the big messages that the medical community is trying to send is that if you suspect that you have coronavirus, don't just show up somewhere. You need to call first. And we're asking physicians who are referring people to our emergency room, please don't just send them. Call first, because we are having, in our hospital at least, we're having people gowned, gloved, masked, face shield, goggles, coming out, putting a mask on the patient, and escorting them to a negative pressure room right away so they're not infecting other people in the waiting room. So call first. Obviously, if you're having difficulty breathing or shortness of breath, just come with 911 and go to the ER. But if you just suspect that you have the virus and you're having some symptoms, please call your physician. They will direct you where to go, where you need to get tested, depending on your severity of illness, and things like that. So call first is the take-home message. But obviously, if you're having shortness of breath or difficulty breathing, call 911 and go to the ER.
And are there any cases of trouble breathing with no fever or cough and no prior history of any breathing issues?
I don't think so, but I can't say that for sure.
Can I just add, from the perspective of the UK, we have something called 111. So anyone who suspects that they have coronavirus with symptoms, they need to call 111. They should not call the general practitioners. We have been told not to take those calls. If we're also told if we do have a case, we should let the hospitals know. But 111, only call them if you have symptoms. If you don't have symptoms and you suspect you have a coronavirus, just self-isolate for 7 days is the information we've been asked to give, and see it through with the symptoms. Yeah, that's what it is in the UK at the moment.
Okay, so building up on that and with symptoms, etc., some questions around, I'm going to ask a bunch of them together really quickly. If someone's had the coronavirus, can they get it again? If someone has been to the doctor within the last few days with a sore throat and maybe some other symptoms but did not get tested, should we just assume that that means we don't have it? Should we just be, and does ibuprofen make it worse? There's 3 for you.
Ibuprofen probably does not make it worse. If you've gone to the doctor with your sore throat and all your symptoms, you should not assume that you don't have it if they didn't test you. So some of the issues that we've had in our country is that there's been a delay in testing and there's been pushback for testing, and so a lot of people haven't gotten tested, but that doesn't mean that they didn't have the virus. And then what was the first one?
The first one was if you had it before, can you get it again?
Yeah. So I have seen a report of reinfection, but very, 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 very rare. So just one report in like 120,000 cases. So take that for what that's worth.
To that too, which is it's very difficult to distinguish COVID-19 infection from the common flu or just another common cold virus. And I think that's the difficulty that doctors have at times. Unfortunately, there is limited testing capability, and even with new labs offering it, the actual kits and the reagents that are being used actually, I found out, are about to go on back order, so we might have more lack of supplies for testing in the future, and doctors may in the future start saying we can't test you anymore, you got to just stay home. So this is going to be a natural progression in that. If you're having symptoms, right now the way that it works in terms of getting approval for testing, if you go through the health department, is that if you're having symptoms of cough and or fever and or cough, or the other way around, cough and or fever, and shortness of breath, or having symptoms, having had travel or being confirmed a case, or if you're have a weakened immune system or other chronic conditions and you're not doing so well, then you may qualify for testing for coronavirus. But if without those situations, it's going to be very difficult to get approval. You can't just go to a clinic or a ER and demand to get tested. That will not happen. If you progressively get worse, let's say you started off with
Whoops, we lost you. Okay, so while Dr. Senna works on that, on her sound there, I just want to say to the person who's asking, did we say don't go to the gym? Yes, we said don't go to the gym. Germs are all over there. Do not go to the gym, exercise from home. Also, we have some questions coming out of the UK that were a little bit confused by what you said. They're saying that did not call anyone for 7 days, not even 111.
Yes.
Ahmed, could you just clarify that?
Yes. So if you're just symptomatic, where you have a little bit of a fever and you're having a dry recurring cough, but you're not like breathless and you're well enough to have like flu-like symptoms, the recommendation now, 111 is inundated right now. You can be on there for 2 to 3 hours because they don't have the capacity. So the advice is stay at home, self-quarantine for at least 7 days, and see how you go. Of course, if you get worse, then you can call 111. And also, you can go onto their website. You can. Oh,
sorry. It all just came back by itself.
Oh, no.
Finish your sentence, Dr. Ahmed. Finish your sentence.
Oh, so yes, they also have an email, so you can actually go online and you can email them your questions, and they'd be able to answer you. Of course, you can call your GP practice if there's specific answers, but we are now running, well, starting from Monday in my own GP practice, and mostly in our area, we are running a telephone triage, but it's only for urgent things. So right now, we're in a kind of a state of urgency and emergency. We need to stay calm, as we've been saying, but we also have to take those precautions. So 111, email them if you're well enough, only call them if you are unwell, and of course, 999 if you're breathless or your breathing is compromised, and let them know you think you have the coronavirus. 999 in the United Kingdom.
Yes, that's important too. In the United States, if you're calling 911 and you think you have coronavirus, please let them know.
Okay, good, important point. I'm going to ask a question. We have about 4 or 5 questions here, and something we have not addressed, which is, what about pregnant women? Can you just speak in general to the issue of being pregnant and dealing with this virus right now? Important point.
So in general, pregnant women have a weakened immune system. Our immune system weakens when we're pregnant. And so you are at higher risk. So I would take more precautions and trying to stay away from people. And we haven't really seen that there's perinatal transmission, meaning that a pregnant woman will deliver a baby with the virus. So that's reassuring. But again, there's a lot of data lacking, and so we don't really know if pregnant women will go into preterm labor. If they, that does happen when women have infections. Sometimes they'll go into preterm labor. So again, just take extra precautionary measures to protect yourself.
Anyone else like to say anything about being pregnant and protecting yourself? Okay, we have some questions around for students and expectations, and I asked the questions, but I know that we don't really know. What is the expectation of timeline? Do you expect that students will return to normal by fall semester?
Return to school?
Yes.
So it depends. It depends on where we are on the curve, and it really depends on that particular community and what's happening in that community. It would be a decision that would probably be multidisciplinary. It would involve public health, it would involve the schools, and it would also involve potentially politicians. So it would be multidisciplinary in many ways. One of the issues with school closures that we do recognize is that communities that are of lower socioeconomic status, they may not have the ability or capability of doing remote learning or online learning. And so that is one thing that for communities that don't have transmission yet is, to recommend hold steady for a little bit. Hold steady. When you start seeing that community transmission is when you start taking those strategies to stagger classes or change schedules, and then ultimately school closure. Because the longer you're out, obviously, those students have a lot to make up.
Okay. I have some people sending me messages in the box about a newborn baby in London that seems to have been tested positive, but I'm going to just assume that this is not because it was neonatal transference. She didn't get it from the mom while she was pregnant with her, but rather after she was born.
No, I read that. I saw that headline too, and it's because, again, like, all the data is still coming out. So in general, we're not seeing that perinatal transmission, but that doesn't mean it's not going to happen or it's not down the pipeline. But in general, we're not seeing it as we think we will. But I did see that headline, yes.
Okay, and I apologize, Dr. Sana. I didn't come back to you. I'm being reminded in the box. I need to come back to you. Please, could you continue and distinguish between the common flu, or not the common flu, excuse me, the flu, and the coronavirus?
I don't know where I left off, to be honest with you, when I cut off. But just to start from the beginning, it's very difficult to actually tell between the flu symptoms, coronavirus, or any other cold virus. And so I think that's a challenge that doctors face in general. So what we recommend is that if a person is having symptoms of sore throat, runny nose, and they call their doctor. The doctor should take the necessary precautions, evaluate the patient, run the regular tests of, checking for flu, checking for other viruses, and if all of those things come back negative, and there's really no reason why they're doing so poorly, or if they say, hey, it's probably a virus that wasn't detected, go home, you're okay, but they end up doing worse, or they don't improve, then to call back your doctor, and you might actually be eligible for testing. One thing that I did mention was that testing is limited in this country, and as more labs open up, the problem is that the test kits that are being manufactured, the supply is low and the demand is high. And so there will come a point where we will run out of testing kits. And so, we are trying to be judicious about who the public health department approves for testing. So we're trying to prioritize high-risk groups for that, people who are weak in immune systems, people who we know might have had contact with a confirmed case or came back from a country where there's widespread disease occurring, or somebody who's doing really poorly in the hospital. Those are people we would prioritize.
So, I'm just wondering here, if we're not having a number of tests, that means we don't know the number of people that are really getting sick. And so, is this comparable to other like other diseases where we don't have the stats? Like, I'm just thinking about this. If we're not testing people, that means in the end we really don't know how many people got it. How will we know when we get 70%? And as you answer this, there's a question: could we please define what is herd immunity? And how should we feel about this if there aren't enough tests? I don't know how I feel about it even.
Well, I can tell you from the people in the front lines, we are very frustrated at the lack of initiative from our leadership up above. We knew this was coming, and we feel in the trenches, we feel very unprepared, and we should have been prepared because we knew this was coming. So there's a lot of frustration in the medical community. I'll let Sana talk about herd immunity.
Yeah, so it is a challenge. One of the big things that we're learning about this virus is that we're not able to capture all of those individuals that are having mild illness. We're really only capturing the individuals that are sick enough to show up at a doctor's office or go to the hospital. So it's always going to be very difficult to know the entire population of individuals who are affected, like Anse was saying. However, I know that across the country, they are setting up they've already have flu surveillance, and surveillance is basically a system to monitor a flu in a particular community. And they've got hospitals set up across the country that do these monitoring of flu, and so they're going to piggyback on top of that COVID-19. So in addition to testing for flu, if they test negative for flu, they will test for COVID-19. So we might get a better picture of what the community spectrum for disease looks like, from mild to severe, but it won't be the complete picture. And in terms of herd immunity, the way that works is that if enough people, there's two ways I can explain it. The first one is that if enough people get infected and then, improve thereafter, then people who have not been affected, and if they're around all those individuals, the likelihood of those uninfected individuals getting infected will be lower after they've resolved their symptoms. The way that it's explained predominantly is through vaccine. So if enough people get vaccinated for this particular disease, once there is a vaccine that develops, then individuals who can't get the vaccine, or if it doesn't work effectively for them, like people sometimes who have weakened immune systems, the vaccines are not as effective. And so for those people, if enough people around them get vaccinated, then the people who are the most vulnerable are the ones that will be protected. And that's what herd immunity.
Quick question in the back. Please go
I
ahead.
think it's important to mention that there is no. I'm sorry. I think it's important to mention that there is no treatment for COVID. It's only supportive care. So it's really important to really pay attention here,
Okay, well,
because we don't have a treatment.
There is a question in the box here about that. Is there really no treatment at all? Nothing that can be done right now? And are people, what does the research look like on that? Are we close at all to finding a treatment?
So there's trials going on in different parts of the world, China, Italy, here, on different medications that may or may not work, but so far nothing definitive, and it usually takes, months or sometimes years to say definitively that this medication works for this virus. So, and in terms of vaccines, if that is going to come up, it'll take about another year or year and a half before we can get a vaccine for this virus.
Oh. Okay. Big political question here. What did China do that we are not, that can get us out of the pandemic phase as they did so quickly? First of all, did they get out quickly? Second of all, are they even out? And third of all, is this something we should be doing? Anybody know? Anybody have any comments about that one?
So I don't know the entire story of China, but what I can say is that they are an authoritarian regime. So a lot of the policies that they can enact may fly there, but may not necessarily fly here in the United States. And so, the unfortunate thing was that there was a delay there in China, and because of that delay, we've seen the almost 85,000 cases there in China. So because of that delay in trying to stop the virus, we saw so many cases there. But the theory is that they were able to, around the end of February, start having daily decreases in their case counts because of the extreme measures they took to limit the movement of people so that they could try to limit the spread of the disease. So that's a theory. They probably need to come out with some more articles and try to prove that, but that's what I've been.
Militarized quarantine.
Militarized. Wow.
Quarantine.
Wow. Okay. So, wow.
They also said that.
Go ahead.
They've also said that they've dealt with the SARS before, and so they have seen this before in a different phase, and so they knew they had policies set in place as well that maybe we don't as much. But that's another thing I heard as well.
Okay. Is there? There's a question here about, is this being recorded? And yes, the answer to that is yes, it is being recorded and will be on our YouTube channel later on so that you can review it if you want to go back and see your question. If you came on late, so I do see some later questions that were answered earlier, so I won't be repeating those questions. So if you do later on get on to watch that, you should be fine. And also the questions that have to do with sort of how do I manage this as a mom with my kids, I'll address those at the very, very end. We're sticking with the medical stuff right now. Number of questions here about Africa. Did Africa have so few? Is that because of the weather there? Anybody know anything about Africa that you can share with us?
So what I can share with Africa, and when you look at the map, you may not see many cases in Africa or Latin America, and that might be because their public health infrastructure is not as robust as other countries. And so there might be actually cases there, but they have yet to identify them. And so we may not necessarily get a complete picture of that at this time. So that's one thing just to keep in mind. So, it is concerning that these countries that have, economic challenges aren't able to report out their numbers, or they are reporting the numbers they have, but the concern is, is it completely comprehensive and they have that infrastructure or not.
We don't know the numbers. How can we expect countries in poor places? Go ahead. Dr. Nour, do you have something you want to say?
No.
Okay. What about buying fresh fruits and vegetables? Should we be doing anything special about washing them? Eating fresh things? Anybody?
I mean, I think I would do the same as prior, but the difference is we may get quarantined, so you might not be able to get your fresh fruits and vegetables if in your area gets more extensive quarantining measures and things like that. But in terms of washing them and things like that, I would do the same as trying to protect yourself from influenza virus or any other virus that's circulating in the country.
Okay, next question here. I'm bringing a few questions together in this one. So we're hearing and obeying about not getting in large gatherings and avoiding that. But what about going for a walk? What about if I want to go to the store and I'm not going to go up to people and kiss them or talk to them? What if I want to go and eat at a restaurant? What if I want to just go and kind of have my kind of sort of normal life, but without or maybe a gathering of 5 to 6 women that are my friends for some social support or just to get together. What about that sort of lifestyle thing?
Again, I think you need to listen to your local health department based on what the transmission is in your area. But if we think about going to the grocery store or going to a restaurant, you are getting into that 6 feet space, because when you're in the line at the grocery store or when you're buying your stuff, the person behind you is not standing 6 feet behind you, and the person in front of you is not standing 6 feet in front of you, and the cashier is within like 3 feet, the waiter is within 3 feet, so all of those things are things to think about. So there might come a time where your health department is saying you can't go to the store, you can't go to a restaurant. Walking outside in the woods by yourself is probably fine if there's nobody next to you. But those are the things to think about. So if you're in a 6-foot distance between you and somebody else, if they're in that 6 feet, that's the transmissibility space.
So let's all think about that 6 feet a minute so we can all get a visual of what 6 feet looks like. I know my father is 6 feet tall, so for me, I can visualize that. Maybe you can all kind of think about what is that thing that is often 6 feet long? What is other than human?
Tall human being.
They usually said 2 meters, which is 3 steps. I don't know if that's as accurate. Like maybe 3 big steps, depending on your.
I love it like that. Okay, so 3 giant steps between you and the person next to you. That's a visual. So everyone can just have a visual of what that is so that we know that we are staying that 6 feet away. Because I think we also can get into this place where we think we're staying away, but then we're not. I mean, what you just said about the lines, I've appointed myself as grocery store getter for my own parents, and I didn't even think about, I'm like at the grocery store, not around any, I'm like staying away from people and making sure that if I've touched the cart, I'm not touching my face, etc. But I didn't think about standing in line or even with the cashier himself or herself. So lots of different pieces of this.
The online shopping is great. Online shopping is great, and grocery shopping and online things. I mean, the government website speaks about staying at home and different things you can do at home. I'm going to plug in Rabata here because we already have online stuff. It's great. You can come on and you can still have that interaction without having to touch anyone. Even though I'm a touchy-feely person, but still, it's a great thing. It keeps you away from that. So it's brilliant. So thankfully, we have other ways to interact and to do things that aren't necessarily have to be in a social gathering or aspect of that, to try and stop this from spreading so horrendously.
Okay, question about pets. Can home pets be carriers of the virus, like cats? Or dragons. We have a dragon in our house.
I don't know the answer to that.
Oh.
So there was a case study of, I think, a dog from Hong Kong that was tested, and they tested positive. But to be frank with you, I don't think that they could necessarily get infected. But what we do recommend for people that are carrying COVID-19 per the CDC is that you try to socially distance yourself from your pet. So you actually do practice that as well. So if you are sick, you.
Okay. My goodness. All right. So what about opening the windows to let the fresh air in? Is that all right? Or is it okay to open the windows and let fresh air in?
Yeah. Recommended.
recommend, especially in England, I'm sure you guys are all about opening up those windows. Any vitamins or supplements that are highly recommended during this time to help protect ourselves?
I think we did mention vitamin C, vitamin C, 1,000 milligram a day. That's recommended, I think, for generally speaking, when the flu season. Some people would recommend taking zinc. Some people are anti-supplements altogether, but I think it is useful in certain circumstances.
Dr. Sadia, would you like to add to that?
I would just like to add, I am not anti-supplement, but I am anti-taking advice from everywhere and then just running out and buying a bunch of supplements because, this person said it's going to be good for me, this is going to save me, and this person said this is the answer, because not every supplement is good for every person. And I think the bottom line that I would give when it comes to protecting yourself as far as nutrition goes is it's got to be a lifestyle. So you can't be out eating whatever you want, eating all the sugar that you want, bread, rice, all this stuff, just, simple carbs, and then just take a pill because somebody told you and it's going to protect you. So it's a really good time, just like this virus is making everybody think about like spiritual health, to also think about lifestyle health and realizing that it has to be something that you just make a decision to do all the time and make it a way of life. And the basic things that I tell my patients, now most of my patients, they have some kind of hormonal disorder, like thyroid or diabetes or something. So definitely, for them, I'm like, okay, processed sugar, as much as you can cut it out of your diet, and also simple carbs, it's going to be better for you. But in general, we know that for general health, you're not going to harm yourself by cutting out sugar, by cutting out processed sugar, by cutting out the simple carbs, and then filling up your diet with a lot of vegetables and putting some healthy fats in there. And you're going to get a lot of nutrients from those vegetables. So most of the things...
Dr. Sadia, I'm sorry that I'm interrupting you, but what happens when we get to that place where we can't get fresh vegetables, and especially people who are dealing with pre-diabetes or diabetes or just really worried about this, and they just, and what are they going to do? What would you recommend at that point if we don't have fresh vegetables to eat?
Mm-hmm. Yeah, that's a very good question. So if you're going to go out and buy any kind of supplements, like Dr. Medic mentioned, vitamin C is a good one to have on hand. And it's kind of ironic because I saw one of my friends had posted a video of a grocery store where everything was sold out, but the oranges and pears. I'm like, nobody took it. Like, there was tons of oranges. I'm like, why didn't you take the oranges? Vitamin C, I think like basic supplements, vitamin D, having some of that on hand, and maybe like either a multivitamin or some kind of B complex vitamin, because those are the basic things that you might be missing. Obviously B12 is mostly from meat, but if you have like a basic multivitamin, you're going to get a lot of those nutrients. But in general, they're just cutting out a lot of the bad stuff is going to help too. Like we know that, infectious disease, whatever, bacteria feed on viruses too. They feed on sugar. So those are the basic things I was saying. Like, Dr. Medic, she mentioned garlic. I mean, garlic is not really harmful, although it is a very hot food, and for some people too much could probably affect them. But, everything in moderation. Throw some good things into your diet. And actually, like you mentioned, Ansley, if it comes down to that point where we do not have access to that, then I would just say have some of those basic supplements on hand. And also like a good omega-3. So some kind of fish oil also has a lot of benefits for health. And so if you need to go a long period of time without being able to get all those nutrients from food that we would typically buy from out, then at least you have like basic nutrients. You're going to be getting the basic things that we need.
And I think maybe it is coming up to spring. Minnesota, not quite yet, but I think in other places it might be the time to think about planting tomato plants and lettuce plants on your balcony or in your backyard in pots, because you will get, then those will grow, at least it'll be some kind of fresh fruit or vegetable. Would you agree with that?
Absolutely.
Alhamdulillah for that option. Again, to the people in the chart who in the box are saying, what about the local gym? Don't go to the gym. Our doctors are saying, stay away from the gym. Germs are everywhere. It seems like we're having a little bit of struggle not being able to go to the gym. Would anyone like to speak to that? Lots of questions about that.
I mean,
infection.
like you said, there's germs there, a lot of germs. There's a lot of people in and out of the gym. I mean, gyms are closing actually in some areas, so you're not even going to have a choice maybe soon in your area.
Maybe make a gym in your house. How's that? Make a gym at home, a little gym.
Yeah, I'm just wondering what the is it because people think that, okay, I need to be healthy now, or is it just like this is a habit? I love to work out. Because right now, I mean, in general, you can't out-exercise a bad diet. It's a really good time to just kind of focus on, working on diet and just doing exercise at home, like Nancy said, a home gym,
For those of you out there who food is your stress reducer, it's a hard time for those people, I would imagine, because this threat of a disease may be causing them added stress, and so they may feel that they may be stress eating without even realizing it. So I think just from my side, my recommendation for that would be get some friends to talk to, even on WhatsApp or Zoom or whatever. Talk to people, talk about how you feel, be vulnerable with your feelings. And if you found yourself eating something, you realize you're doing it, don't be like, oh, that's it, khalas, it's over. Just stop and switch over to the healthier things for as long, if you can. How many days?
I just would like to add to that, and I'm sorry, Nancy, when you're talking about like managing feelings, I think talking to people is great. And then I actually recommend to my patients to journal. It might be a good time to start journaling because you're at home now and you have time. And, when you feel like you're going to go for the food, maybe just sit down for 10 minutes and just get your feelings out on paper. That helps in so many ways. It helps to, because feelings and stress sit in the body and they'll find a place in the body to sit. And for different people, that can come out as pain, that could come out as stress eating. And getting it out can be really helpful.
Okay. Back to sort of more specific medical question. How many days should I stay home after my symptoms have abated?
So the recommendation is to stay home for 14 days, 14 days total. So whether that's 14 days from when you start having symptoms but you don't know you actually have COVID-19, or 14 days from when they test you and when you do the test and they say you're positive. That's been the recommendation. So it's been that 14-day window.
What would you recommend for someone who has someone in the family who's passed away? Should they try to attend the funeral?
I think that's the question that's going around among the ulama about funeral prayers and what's going to happen with that. I mean, if the Salat al-Jum'ah is being canceled, I don't foresee that the Salat al-Janazah moving forward, and so actually had a conversation yesterday with someone who is a masjid leader and really just giving a lot of pushback about why canceling Salat al-Jam'ah and how many different ways, scenarios that it could be done. And finally he said, well, if we all stand 6 feet apart from each other and we're outside and we have a tarp that we're going to throw away after, would you say that's okay? And I said, yeah, that's okay if everybody, if we're moving to our cars 6 feet apart from each other also, like we're not all walking to the car at the same time. I just don't imagine how that happens, but whatever, if that's what you need, that's fine. So I'm just saying, like, Salat al-Janazah, I'm not sure how, like, that's going to happen in this time period. And it's really something we need to think about because, you know, again, this virus affects the elderly and the mortality rate is high in people who are over 80. So that's something we really need to start thinking about.
I mean, we certainly can do Salat al-Janazah al-Gha'ib for as far as doing the prayer for people. But I do understand the concern of wanting to be with family members too if someone has passed. So I guess that's just recommendations that you've been giving this whole time around don't hug, don't kiss, don't touch, stay far away while you're giving support. Would that be right? Would you agree that that's...
Yeah.
Okay, and along with that, we have, these are some feelings, maybe can address them around, what about my mother who has many health problems, but this is going to be going on for a long time, and this limiting their interaction between she and I is one thing, but limiting interaction between she and the grandchildren is really difficult for her, and especially as we're thinking about this lasting for a while, what would you suggest around that?
I mean, it's going to be hard. Like I'm having the conversation with my husband and about the grandkids and his parents, like my kids and his parents, especially because I'm high risk. And we had that conversation with them, and we all have to do our part, and again, it just depends on your local health department. There may come a time where they're saying, like, everyone has to stay in their homes. Like, we should put that in our mindset. That may come. That time period where they're telling us we all have to stay home may come. And so everybody has to do what they can, knowing that the more people we're exposed to, the bigger the risk. And so everybody has to make those decisions about themselves, about their parents, about their grandkids.
I feel like I'm at school here. But I think maybe Dr. Sana and Dr. Nour can correct me. I did see a publication from Italy that one of the reasons why they had such a large community transmission because of the kids and the youth were non-compliant. They were transmitting the disease.
Go ahead.
Did you hear me? The kids and the youth were non-compliant. Okay. The paper from Italy saying that the kids and the youth were non-compliant were actually transmitting the disease because they were asymptomatic. So it's really important. And that they showed that was one of the big means why it spread so fast in Italy. Not because of the symptomatic people who self-quarantine, but because of the young people who didn't listen.
In the United States. Like, we're seeing all these young people being like, oh, the airlines are so cheap now. I'm going to Bermuda or wherever they're going. And it's going to be a problem. And that's like one of my biggest concerns is that even if me and my neighbors are doing the right thing and somebody else isn't, it's not going to work. We need everybody to be all in.
Okay, here's a question. I saw someone make their own face mask with 2 sheets of paper towel and rubber bands. Could we do that? Does not use up all the supply.
I mean, you could, but I don't know if it's going to help.
What I heard is that the virus is too small and it will go in. The pores are just too big. Except if you have a specialist mask that actually that is actually only specialist that is very super expensive and is only bought in the hospital. It's not really going to do very much for you.
Looks like also we have a question here. Just for clarity, is it airborne?
It's not clear. So when physicians are doing aerosolizing procedures, so things that make things come out in the air, we're wearing the N95 masks, which are things that protect you from airborne particles. So it's not clear, but it might be or could be. And so in the United States, we're putting people in negative pressure rooms, and that's what we do for diseases that are airborne, like tuberculosis or varicella, chickenpox.
Okay.
And just to add to that, it's probably more like the other coronaviruses. So it's probably respiratory droplet. And the reason why they're more conservative to healthcare providers is because they're at higher risk because they do more invasive procedures. And for that reason, like Dr. Nour was saying, they do these procedures that cause them to become airborne. They aerosolize in the air. So for that reason, they wear the N95 masks. I definitely do not encourage people to go out and try to buy N95 masks because it won't work. And additionally, the state and the federal health departments have said that doctors in urgent care clinics and outpatient clinics can evaluate these patients in a private room that isn't necessarily airborne. So I think the predominant thought is that it probably is respiratory, but to be on the safe.
Okay, we're heading down here. We have about 7 minutes left. I still have lots of questions. A lot of them are quite, just to let you know, some of the questions that are in the box are repetitions of earlier questions. So if you do watch the recording, you will get an answer to your question, just so you don't feel frustrated that I didn't ask it. Also, there is a comment in the box from a physical therapy specialist who is saying there are lots of ways to work out at home. Definitely do that. You might want to order some equipment to make that easier for you. Also, lots of questions in the box that sort of refer to earlier comments here about why is this such a big deal. Again, I will refer you to the recording when it comes out that we did answer that earlier. What about at home? So now we're at home. Let's say we're doing our best. We're not going out. We're socially isolating ourselves. But like my daughter asked me, she said, "Mom, maybe I should not come home because she has to go to work. Maybe I should go and stay with her sister." We did address that a little bit later, but let's say we tell her, "No, you go ahead. You can still stay home in the comfort of your home." But how then should we be interacting at home as family members?
Sana.
I think you need to practice social distancing. You want to really protect your elders as much as you can. So when you do interact with them, try to maintain your distance. But if you're in the same room, that's fine. Maintain that 6 feet. You can still socially interact with them. Make sure you wash your hands frequently if you're planning to even shake hands or touch them. But really, really be cognizant that you are trying to protect your elders, because if there's anyone who's going to be affected by this, it's going to be our elder parents and our elder loved ones. And so there is always that risk, but always, if you can take your necessary precautions, like covering your cough, good cough etiquette, hand hygiene, and if you're sick, definitely keeping that space between you and not even interacting, trying to totally be separate. And
one more real technical question. Can you explain the difference of how viruses infect the body versus bacteria?
I mean, there's different ways that's maybe too broad of a question, because there's different ways that bacteria get into our body than viruses, and there's different bacteria. But in general, these respiratory viruses like coronavirus enter our bodies by us inhaling the droplets, or by us touching a surface where the virus is, and then touching our portals of entry, which again are your eyes, nose, and mouth. Once we have a virus replicating in our body, especially a respiratory virus, we get increased secretions. So whether that's in your ears or your lungs or your upper respiratory tract, and once you have a lot of secretions, that becomes bacterially super infected, and that's how you get like a bacterial pneumonia after a respiratory virus. So the bacteria get into the secretions, and then they proliferate, and then you get a pneumonia or ear infection or things like that. That's just a broad microbiology 101, even more basic than that.
Thank you for that. Okay, I think that as far as the rest of the questions that are, go ahead, Amina.
I'm just going to come around to, we mentioned bathrooms, and we mentioned, having different bathrooms. I had the thought for the people who only have one bathroom at home, usually what's recommended is that you do a rotation for your showers. So what happens is anyone who's not infected or there's a risk of an infection goes in first, and you're the last one who, if you fear that you're infected, you go last, and then you clean down the bathroom. The same thing if you're going into the bathroom, what we call toilet in the UK, so you're not showering, then what you do is you actually also clean the surfaces. So there's a lot of cleaning that you should do before in order to protect other members of the family from interacting with the infection. So it's very important to do that. Also, have your own utensils. Don't use anyone's utensil. Don't eat with them. Clean down the surfaces if you're cooking. Cook on your own. Make sure you do all those things so that you can prevent other people from catching the virus.
Yeah, I just wanted to add to that. That's a really good point. Like using chlorine or hypochlorite really eliminates this virus, so it's easy to eliminate it from the surfaces that we're talking about. So just wiping down your counters, wiping down very heavily touched surfaces, so door handles, your cell phone probably has a lot of viruses, and things that we touch often. So just if you use like a basic Clorox or Lysol wipe, those will inactivate the virus.
What about the dishwasher?
I'm pretty sure the high temperatures would do it as well.
You need to push the button that says Fanny rinse, or will the regular one work?
I'm not really sure.
Okay. All right, but alhamdulillah for the dishwasher in all cases. All right. So here we are we just have 1 minute left, so I want to be respectful of all of your time and the time that you've given us here. Thank you so much, everyone, for being here. I want to respond to the questions that were non-medical very quickly. Those of the mothers who were asking questions about what am I going to do with my kids now that they're going to be home for so long, we will take note of that as Rabata as an organization, and we will try to have something for you that has like ideas and stuff, and hopefully we'll be able to provide even more than that going forward. Regarding the questions about Ramadan, yes, you will. Even if we are in isolation, you will still fast in Ramadan.
It's
of course,
6 o'clock.
If you're sick, they're telling me, hurry up, Tamara. Of course, if you're sick, that's something you're going to be working with your doctor. But if you're not sick and you're just socially isolated, you're still fasting Ramadan. Fasting Ramadan is not related to whether or not we're getting together at the masjid or not. And you can still pray Taraweeh on your own at home. It does not have to be prayed in Jama'ah. You can pray it at home, and maybe we want to look at this as an opportunity to sort of practice our Quran reading and practice our recitation. And we will have a Ramadan workshop where we will address specifically in the case that you're at home. So we'll also address that at a later date. For those of you who also were asking questions about your own feelings of social isolation and your emotional issues and how you're struggling with that, I did hear the doctor saying that some of you asked here in the questions, what can I go for that walk? Can I look at people from far away, especially for those of you who live alone? Yes, they said you can walk as long as you're not walking next to people and you're not getting too close to them. You want to be really careful. But let's use Zoom, guys. Let's use Zoom and WhatsApp and take this opportunity to talk to people and get online and share. And if you are a Rabata student or in any way connected to Rabata, especially if you have a local chapter, we are handing out Zoom links with our own Zoom account so that your local group can kind of get together and hang out on Zoom. So if you don't have a local chapter, you can check out our website, rabata.org, to see if you do. I guess that would be first. And if you don't, email whoever it is that you email, whether it's Rabata or Circles of Light, for some advice about that. And I think with that, that's about all of there are some other questions about school and things like this. But again, like I said, we'll have something else to address those kinds of issues. I apologize for all of those who did not get to your questions. For the most part, I feel like we addressed the basic subjects of the questions that were in there. Perhaps we could have a forum where questions are there, but where we could address them if necessary. But and the YouTube, what we could do is if you do put a question in the comments, we could visit with the doctors and see if they have an answer for you, especially if it's something very specific. Remember that all of this is general information. If you have specific questions, you have to speak to your personal doctors. If you do not have a personal doctor, last question, what if you don't have a personal doctor? What do you do then?
Register in the
establish a relationship with one.
Okay. Okay, that sounds hard at this point, but there you go. So,
well, 111 in the United Kingdom or any urgent care center, you don't actually require to have a general practitioner to actually speak to them. So you could always do that, but we always recommend that you always register with a general practitioner. It's very important for your health.
All right. So, okay, so great. Thank you so much. And I hope, for me, this was really wonderful. It's been very helpful for me. I feel calmer than I felt ahead of time. And so I really appreciate it. I hope everyone else feels calmer based on this. I really appreciate you all being here. Thank you very much. Thank you for all of you who joined us today. And I hope that it was beneficial for all as well. Thank you very much. And you can find out more information about the work that we do if you're not already familiar with our work at rabata.org, RABATA.org. We have all the social media stuff too, Facebook, Twitter, Instagram, where you can also follow our work.
Thank you, everyone.
Thank you so much.
Assalamu alaikum. Jazakumullah khair.